My name is Ilaria Galetti. I am based in Italy. I was diagnosed with interstitial lung disease just 6 months after the diagnosis of systemic sclerosis. I was walking in the mountains and I realized I was breathless more than I used to be. A connective tissue disease has a high impact, but also systemic sclerosis, because it's rare, it's chronic, it's life-threatening, and it's a complex disease. So it's a multi-organ disease. Traveling becomes more and more difficult because you have to reserve quite in advance the oxygen, and not everywhere is possible, not at least as a last-minute travel, despite what the European Constitution says, that every citizen in the EU is free to move within the EU borders. We started working about 2 years ago at guidelines, and they immediately involved patients. And why is important to involve patients? Because simply we live with the disease, and sometimes we have different perceptions, not wrong or right, but different. And working together with clinicians is complementary. It's not an alternative. Maybe we have some PICO questions that were not contemplated by doctors. The major difference was pushing together the two different European societies, the European Respiratory Society on one side, and EULAR, the Society of Rheumatology. So putting together pulmonologists and rheumatologists really is opening a new wave of taking care and cure the patients. I know there is not enough time during a consultation, but it's important that clinicians make feel the patient in front of him, her, in a safe place, able to ask as many questions as possible, and according to this, make a shared decision. And the patient must be aware of why he's taking a medicine, on why has to make a certain kind of pre-rehabilitation. These guidelines will pave the way for a future approach, a holistic approach, a interdisciplinary approach, and believe me, this is a lot. This is a lot because it was not in the past, and I'm really proud of the clinicians that wanted this new approach. Really, really proud.